Welcome back. We told you a few minutes ago about a possible new coronavirus treatment.
The Trump administration fast-tracked the emergency use of convalescent plasma in patients suffering from COVID-19. But not all scientists are convinced this is the best course of action.
Dr. John Whyte, he's the chief medical officer of WebMD. He joins us live. Dr. Whyte, thanks for being with us today.
Sure. Thanks for having me.
Let's start with this first question. A lot of people are concerned don't know what convalescent plasma is. How is it extracted and how does it work?
Sure. So remember, if you get COVID-19, your body's going to develop antibodies. And I'm going to want to what we call harvest those antibodies. So basically, you're donating blood. And then I'm taking antibodies from your blood, and then I'm purifying them. And then I'm putting them into someone else through donation of blood that I've added the antibodies back in. So that's what convalescent plasma is. It sounds, pretty cool in a way if I take your antibodies and give them to someone else, that there'll be a cure. But we need to look at the data a little more closely.
And that really kind of leads us to our next question, Dr. Whyte. There's been a lot of controversy about how impressive or not the initial trials are. And maybe then the follow-up question to that is how much closer, if any, are we to a vaccine from this?
Well, let's talk about the trial. So those folks that got convalescent plasma, usually within the first 3 days or so that were not already on a ventilator, they actually were alive. The chances that they were alive several months from then was 35% higher than those people who might have received convalescent plasma later in the course. So it's not a true what we call placebo control, meaning I got convalescent plasma and you didn't, and then I compared it. I got convalescent plasma earlier on in the disease than you did, then I compared it. So that's why it's a little harder to tell how effective this is going to be. And remember, it's not like a pill that I can manufacture millions and millions and millions, if not billions of pills. I need to collect plasma and get people to, give blood. And then there's the risk of putting, blood in you. As to how close to a vaccine, I don't think this really has any bearing on, where we are in the vaccine, but it does give us some credence, some belief that antibodies actually will be around and last for a while. It's still going to be a bit of time until we see a safe and effective vaccine on the market. And this really just reinforces that we need to have transparency. We need to know the data and be able to look at it ourselves.
Dr. Whyte, we appreciate your insight. Families who have loved ones suffering with coronavirus will certainly be talking with their local doctor about convalescent treatment. Okay.